and the term of cytokine storm has already been labeled for this pronounced inflammatory response. So in general, the recommendation that all patients with COVID-19 and diabetes should have continuous and reliable glycemic control during the COVID time, and this will move with us to the need of frequent blood glucose monitoring, and we can see how the pandemic affecting maybe the diet, the exercise habits for all patients, and even for all people in general have been affected, and this would be more serious for diabetic patient. They tend to have more fluctuation in the blood glucose level. This is very expected, and those maybe diabetic patient with suspected fever are required first to follow the sick day rules, as if the sick day rules with all the precautions to avoid any medication that predispose to dehydration or the maybe further worsening in the renal function. They tend to be considered for more frequent blood glucose monitoring, and of course assess the need of discontinue or adjust certain maybe diabetes pharmacotherapeutic agents, and this one will be highlighted in the next part, inshallah. So this all regarding the glycemic control. The second implication of the COVID-19 and diabetes, the metabolic control. As all of us know, that diabetes is not just about the glucose level. It is not the glycemic control. It is a metabolic disease, affects so many of the metabolic parameters. Pronounced, of course, the glycemic maybe uncontrolled, but all the metabolic parameters should be considered in order to maybe provide optimal care for diabetes patient. All these metabolic parameters should be considered. So all patients with diabetes in the very beginning in the pandemic, if even patients without diabetes, those at high risk of the metabolic disease, those patients should be monitored for new onset diabetes. Okay, and the reassurance on the diet and exercise modality, the lifestyle modification, should be considered more, especially if maybe us as a community pharmacy, for example, this will be part of more assertive counseling among diabetes patients, among patients on risk of diabetes. What about patients who already have diabetes? For this patient, we in metabolic control, we tend during the pandemic to be more to apply more intensification for the metabolic control, and in the literature they mentioned this intensification of the metabolic control among diabetic patient as important as a primary prevention of the COVID-19 disease. So apply metabolic control means maybe control the levels, control maybe the cardiovascular, maybe underlying or common problem like hypertension is as important as you go for the primary prevention of COVID-19 disease, the hand washing, the physical distancing, the one all of us become very aware during that time. And in the metabolic control, of course, we have to stand in front of two conditions that commonly will be presented among type 2 diabetes patients: hypertension and dyslipidemia. In one of our research paper, when we collect data about type 2 diabetes patients, we found roughly that maybe the 88% of them will be having at least hypertension as a comorbidity with diabetes at the time of the presentation in the primary setting, in the primary care setting. So the care of hypertension and dyslipidemia among diabetic patients as a part of the metabolic control is very important. And very important because when we talk about dyslipidemia, of course, come to our mind the statin therapy. And when we talk about statin, we remember that statin has pleiotropic effect, and have been reported so many times to have anti-inflammatory effect. And this actually maybe make some of the hospital, even in the US, to include statin therapy as one of the COVID-19 treatment protocol, one of the medication to be given for the COVID-19 patient. But of course, this one, the off-label use. There is no maybe valid indication for statin to be used in this one, this off-label use. When we talk about dyslipidemia as a metabolic control, also we have to pay attention. The statin therapy have many drug interaction with the antiviral agent. Actually, most of the medication that have been or currently tested as antiviral agent for COVID-19, those agents have degree of drug interaction with the statin. And as we all know, maybe statin, different agents has different drug interaction profile. So we cannot assume that the drug interaction profile of statin will be the same for all. And that's how, as a pharmacist, sometimes we recommend certain changes between statin based on safety concern. So in conclusion, when we talk about dyslipidemia in diabetes as a part of the metabolic control, statin should be continued. No need to discontinue statin therapy among diabetic patients infected with COVID-19 infection. So statin to be continued. So that's all about dyslipidemia. What about the hypertension? Hypertension treatment, of course, when we talk about hypertension and diabetes, we think straightforward to ACE inhibitor, right? And when we talk about ACE inhibitor, we remember, and hopefully you remember, what we talk about the specific mechanism between maybe the diabetes and COVID-19, which is related to the ACE2 expression. So what we can see here as maybe we can say in conclusion that as we know that the medication, the ACE inhibitor, can increase the ACE2 expression, okay? But this all observation from preclinical study. It is yet to be established clinically in human, okay? This one. So in the first, there is no robust clinical data that the ACE inhibitor really do maybe increasing ACE2 expression in human. This one. The second point, if you maybe opt to discontinue ACE inhibitor, especially in patients with maybe severe myocardial infarction or patient with heart failure, in which maybe ACE inhibitor, one of the main mortality benefit medication, I think from the other side, you predispose patients to some sort of clinical instability, and another set of adverse health outcomes should be would be there. So we have to be careful, and that's why the latest expert panel recommendation for ACE inhibitor, for NRAS inhibitor, the renin angiotensin aldosterone system inhibitor, it should be continued. There is no recommendation to discontinue this medication, and should be discontinued even in patients at risk or evaluated or even with COVID-19. So at risk, evaluated, or even with COVID-19, for all these patients, the hypertension treatment should be continued. So now we come to the last part from the second section. So we talk about glycemic control. We talk about the metabolic control. Now we tend to I believe the most relevant as a pharmacist to talk about medication. So special consideration on use of anti-diabetic drugs. And this one is very relevant. Of course, when diabetic patients have intercurrent illness, infection, for example, it is maybe straightforward, will be high risk for hypoglycemia, dehydration, all the DKA and HHS